This is now the case of a patient with ischemic cardiomyopathy implanted with a single lead ICD. This is an episode diagnosed VT in the memory of the device. You see here a sudden acceleration. The rhythm is quite unstable. Initial detection of an episode of VT, a burst is delivered, and a return to the initial rhythm. In this patient, the ventricular rhythm is quite unstable since you can find 80 milliseconds difference between this interval and this one. In this patient, the stability has been programmed off. If it had been programmed on, then the VT counter would have been reset to 0 on this cycle. When you look now at the results in terms of wavelets, you can see that all 8 QRS complexes, there is a no match since the percentage of similarity is very low and much lower than the program threshold, which is 70%. So clearly the wavelet is in favor of a ventricular tachycardia. In this patient, the only discriminator which was programmed was the wavelet, which was on, whereas the two other ones were programmed on off. This is now what is recommended in the new guidelines. Indeed, in the Medtronic single lead ICD, it's recommended to program only the wavelet on. In the Medtronic single lead ICD, if you program all 3 parameters, then for a diagnosis of VT, you need to have a sudden onset and a stable rhythm and a different morphology. If at least one of these 3 parameters is in favor of SVT, then the diagnosis is going to be SVT. We know that there are some limitations for the stability parameter or the sudden onset. That's why it is recommended in the new guidelines to program only the wavelets when it works appropriately.